Alice in Wonderland Syndrome, AIWS, is a fascinating neurological condition that alters one's perception of reality. Individuals experience the world in distorted sizes, akin to Alice's adventures in Wonderland. This peculiar syndrome draws its name from Lewis Carroll's famous tale, Alice's Adventures in Wonderland. The story's bizarre size-changing experiences mirror the symptoms of AIWS, intriguingly linking literature and neurology. The hallmark symptom of Alice in Wonderland syndrome is a distorted sense of size. Sufferers might perceive objects as either much larger or smaller than they actually are. This can apply to their own body parts or to the external environment, creating a disorienting experience that challenges their interaction with the world around them. The causes behind Alice in Wonderland syndrome are as varied as its symptoms. While some cases are idiopathic, meaning their cause is unknown, others are linked to migraines, brain tumors, or the use of certain medications. This variety suggests a complex interplay of factors that disrupt normal perception and cognitive processes. In comparing Alice in Wonderland syndrome in children and adults, notable differences emerge. While children often outgrow the condition, possibly due to brain development, adults may experience it as a symptom of neurological or psychiatric conditions, making it more persistent. Migraines play a crucial role in Alice in Wonderland syndrome, with a significant number of sufferers reporting migraine headaches. The connection lies in the aura phase of migraines, which can alter sensory perception, closely mimicking the symptoms of AIWS and providing a fascinating insight into the condition's neurobiological underpinnings. Migraines are intricately linked to Alice in Wonderland syndrome, AIWS, often acting as a precursor to the condition's unique symptoms. This connection is due to the neurological disturbances migraines cause, affecting sensory perception. Understanding the medical underpinnings of AIWS involves exploring various causes, from migraines to brain tumors. Infections and certain medications have also been identified as triggers, making the condition multifaceted in its origins. When comparing AIWS in children and adults, differences emerge primarily in how symptoms are perceived and reported. Children might not articulate their experiences well, making diagnosis challenging, while adults can more accurately describe their symptoms. Diagnosing AIWS typically involves a thorough medical history and neurological examination. Since there's no specific test for AIWS, doctors must rule out other conditions first, relying heavily on patient descriptions of their experiences. Treatment for AIWS is tailored to the individual, focusing on managing symptoms and addressing underlying causes like migraines. Medication can help control symptoms, while cognitive behavioral therapy offers a non-pharmacological approach to coping with the condition. Cognitive behavioral therapy, CBT, has emerged as a promising approach for patients grappling with Alice in Wonderland syndrome, AIWS. By addressing distorted perceptions and anxiety, CBT helps individuals reinterpret their experiences more accurately and calmly. The daily challenges of living with AIWS can be significant, affecting personal and professional lives. Individuals share their stories to shed light on the real-world impact, offering insights and fostering a deeper understanding of this complex condition. Developing effective coping strategies is crucial for those diagnosed with AIWS. Techniques such as mindfulness, stress management, and establishing a supportive network can significantly improve quality of life, empowering individuals to navigate their symptoms with confidence. A notable correlation between epilepsy and AIWS has intrigued researchers. This connection suggests that disruptions in brain activity characteristic of epilepsy could trigger the distinctive perceptual distortions seen in AIWS, prompting further investigation into potential shared pathways. Recent neurological studies have delved into the intricacies of AIWS, employing advanced imaging and diagnostic tools. These research efforts aim to unravel the syndrome's underlying mechanisms, offering hope for more targeted and effective treatments in the future. Visual illusions play a pivotal role in Alice in Wonderland Syndrome, offering insights into how our brains process size, distance, and other spatial relationships differently under this condition. The science behind these perceptions is not only fascinating but sheds light on the complex interplay between the brain's visual processing centers and our conscious experience of the world. Brain imaging techniques have revolutionized our understanding of Alice in Wonderland Syndrome, allowing researchers to observe real-time changes in the brain as symptoms manifest. This has opened new pathways in identifying the specific areas of the brain that contribute to the syndrome, offering hope for more targeted treatments in the future. Alice in Wonderland Syndrome has transcended its medical origins to become a point of fascination in popular culture, inspiring references in literature, film, and art. This cultural footprint highlights the universal curiosity and empathy towards experiencing the world in vastly different scales and perspectives, mirroring the adventures found in Lewis Carroll's iconic work. Future research and treatment of Alice in Wonderland Syndrome hold promising prospects, with ongoing studies aimed at unraveling the neurological underpinnings and improving management strategies. As our understanding deepens, there is optimism that patients will benefit from more effective interventions, reducing the impact of the syndrome on their daily lives. Living with Alice in Wonderland Syndrome presents unique challenges, yet it also offers a unique perspective on the fluidity of perception. As we look ahead, the experiences of those with the syndrome continue to teach us about the resilience of the human spirit and the vast mysteries of the human brain, encouraging a deeper exploration into the realms of perception and reality.